Thank you, Mr. Speaker, and thank you to the ranking member for your exceptional hard work in producing a Republican alternative that does not raise taxes, raise premiums, increase our debt, or increase health care costs. In a recent article, Democratic leadership stated that getting votes today will be easier because Democrats want to go home. Mr. Speaker, the Pelosi health care bill will cost Americans more than 5 million jobs. Despite national unemployment at 10.3%, and in my home state of Nevada over 13% unemployment, we are moving forward with this bill. For the majority, this is fine if members of Congress get to go home. This legislation raises billions in new taxes on small businesses and increases health care premiums by $15,000 per family on average. But as I said, as long as the majority gets to go home, this doesn't matter. This bill cuts $500 billion from Medicare, affecting more than 20,000 seniors in my districts, over 100,000 statewide, and also avoids meaningful medical liability reform. But the majority will support it because they get to go home. This bill's individual mandates will result in 9 million Americans paying a new tax or facing criminal penalties. These penalties include $250,000 fines and or 5 years in jail for failure to pay the tax. However, this doesn't matter as long as the majority gets to go home today. Mr. Speaker, this bill lacks enforceable citizenship verification provisions. As many as 8.5 million illegal immigrants will be eligible for taxpayer-subsidized health care under this legislation. But of course, if the majority gets to go home, it simply doesn't matter. Yet the height of hypocrisy is that members are not required to participate in this government-run health care program. Unfortunately, the strategy to pass this massive bill hinges upon members of Congress wanting to go home instead of passing legislation that will help the American people.